Thank you, Mr. Williams, and a pleasant good afternoon to everyone. My task, as per usual, is to share with you the situation report for today, July the 2nd. It's been 1 year, 5 months since we've been responding to the COVID-19 pandemic. Last March, between March and July, we fought the first wave of this pandemic. And so this year, 2021, on May 19, we identified the first case in this wave. And over this past 6 weeks, we have added 431 cases to the Federation's COVID-19 tally. To date, 160 of these individuals have recovered, meaning within the last 6 weeks, 160 cases have recovered. At present, we have a cadre of nurses and physicians monitoring the 268 active cases. At present, we have 8 COVID-19 or 8 individuals diagnosed with COVID-19 admitted to the Joseph N. France Hospital on the COVID ward. So at present, 8 individuals who are diagnosed with COVID-19 are admitted to the JNF General Hospital on the COVID ward. At present, or to date, we have recorded 3 COVID-19 related deaths. This map highlights or shows the areas where the COVID-19 cases are concentrated. And you can see the clusters were identified in St. George, St. Peter's, St. Mary, along the East Coast to Christchurch. So this map highlights where the outbreak is concentrated. Shows the parishes where the outbreak is concentrated. This slide highlights the epi curve, and you can see that we started seeing a surge in cases from around about the 6th of June, and then the plateau continued until round about the 23rd, 24th of June, and you can see the trend is downward at this time. And so we are getting a handle on this wave or this current wave of COVID-19 cases. The public health measures that we are employing, they are working. Now this slide summarizes the outbreak at present, and so we have reported a total of 476 confirmed cases of COVID-19, 17 cases for Nevis, and 459 cases St. Kitts. As I said before, 205 cases have fully recovered, and this is between last year to present. A total of 205 persons have fully recovered, and we are monitoring the active cases, which amount to 268. As I said before, 8 hospitalizations and 3 COVID-19 related deaths. Now, I need to provide you an update on the COVID-19 outbreak at Her Majesty's Prison. Now, on July the 1st, yesterday, we identified an additional 13 inmates who have been diagnosed with COVID-19. And so yesterday, we identified 13 new cases within the prison system. So this brings the total number of inmates diagnosed with COVID-19 to 55. 55 inmates have been diagnosed with COVID-19 related to this outbreak. But it's important to note that 40 of these inmates are well on their way to recovery. We had a mass testing at Her Majesty's Prison 2 days ago, and 40 of these inmates, they have received their first negative test. They were retested today, and we are keeping our fingers crossed that their tests would return negative. In order for you to be deemed recovered from COVID-19, you will be serially tested until we get 2 consecutive negatives. When you get 2 consecutive negatives, you are deemed recovered. And so we are hopeful that within a few days, 40 of the 55 inmates would be deemed recovered. Now, at present, in terms of the staff at the Her Majesty's Prison, we have identified a total of 8 staff members who were positive with COVID-19. Now, 6 were identified yesterday, so 6 staff members recently diagnosed with COVID-19, 2 at the beginning of the outbreak in the prison. Now, 2 of these 2 original staff members, they have since recovered. So we have 6 active cases amongst the staff at Her Majesty's Prison. So this just provides you an update on the COVID-19 outbreak at Her Majesty's Prison. The SARS-CoV-2 variant that is in circulation in the Federation is the Lambda variant. We shared this information, a few days ago. Now, this variant, the Lambda variant, was first identified in Peru in August of last year. It has since spread to over 29 countries globally. It's quite prevalent in the South American countries, including Argentina, and it is in circulation here in the Federation of St. Kitts and Nevis. To date, we can say it's definitely more transmissible than the variant that we identified last March 2020. Now, this week, Wednesday, June 30, the previous batches of COVID-19 vaccine, they expired. So the previous batches of COVID-19 vaccine that we received earlier, they expired on June the 30th. Now, on June the 30th, at the end of Wednesday, June the 30th, a total of 18,913 persons were deemed fully vaccinated. In other words, they received their 2 doses, and this amounts to 57.2% of the target population. And we achieved a coverage of 69.4% of the target population receiving their first dose. So in essence, at the end of workday Wednesday, 41,850 doses of the AstraZeneca Oxford vaccine were administered. Now, we have received a number of questions. So 41,850 doses of the AstraZeneca Oxford vaccine, that's more than what you received. Now, we were sent, the Federation, we received 41,600 doses or 4,160 vials. But it's important to note that from some of these vials, we were able to get more than the 10 doses per vial. The nurses would tell us that, from one vial, you may get 12 doses from a vial. And so that's why we were able to administer more than what we were officially, given. So again, we administered 41,850 doses of the AstraZeneca vaccine. Now, our vaccine, even though the first batch expired, our vaccine program continues. Ladies and gentlemen, the way forward, what's the way forward? As individuals and collectively, we need to adhere to the COVID-19 protective measures and behaviors. So that's the way forward. These are the measures that's going to get us out of this wave of infections and out of this pandemic, meaning these measures are going to protect us from the virus. And for one, it's sheltering in place, because here in St. Kitts, we are in a lockdown until about the 12th of July. And so we are asked to shelter in place, only leave if it's essential. So if you're an essential worker or on the days of limited operations and you need to get groceries or go to the bank, you need to remain in place unless you're moving for an essential reason, an important reason. We need you to wear your face mask. That's very, very important. Once you leave your home, once you're going out into the public spaces, you need to wear your face mask. We want you to sanitize your hands after touching those high-touch surfaces. That's very important. We need you to maintain that safe distance of 6 feet from others. Whenever you go to the grocery stores, supermarkets, pharmacy, please maintain that safe distance. And it's important also to boost your immune system. I want to also add those individuals who are part, if you're a member of a household whereby if you have a relative that's diagnosed with COVID-19, it's important for those individuals within that household to wear your face mask, sanitize your hands before and after interacting with the individual who is diagnosed with COVID. And, well, I must say that you should have minimal contact with the individual who is diagnosed with COVID. That individual should be self-isolated in his or her room and should have an assigned bathroom, restroom, whereby the individual alone uses that bathroom or restroom. If that's not the case, it's important to sanitize before and after using the restroom and maintain that safe distance from the individual who is diagnosed with COVID-19. And again, we all need to boost our own immune systems. Thank you.